So what are the two conditions wherein you may need to stop taking your antihypertensives? And gentlemen, it's me, Dr. Mrs. Ezinne. I'm your host here on Chilling with the Doctors, and on this channel we share with you tips that will greatly improve your physical health and your soul's health. You know, when your soul prospers, your physical health will also prosper. In today's topic, we're going to be answering a simple question that people ask every day. Must I take my drugs every day? If you have been living with hypertension, you will know that one of the major challenges you're having is actually taking your medication. Sometimes it's not because these drugs are expensive, it's just that it's tiring. Almost everyone I see in the hospital, from time to time, they get tired of taking this medication. So today, before I tell you the two conditions where you should stop taking your drugs, yes, there are certain times you should stop taking your drugs. But before I share with you those tips, those two conditions, I want to explain to you why you need medication. Why do you need this? Why do you need these tablets to take care of your blood pressure, even when it's not giving you signs? So before we go on, what exactly is hypertension? Hypertension basically means that when your blood pressure is checked, you check your blood pressure, the systolic, that's the upper value, is greater than 140, and the lower value, which we call the diastolic blood pressure, is greater than 90. So when you have more than 140 over 90, we say that somebody has hypertension. And what this basically means is that the pressure in your blood vessels, the blood vessels that take blood around our body to our head and every other organ, it means that those blood vessels are under pressure. Many times they become narrower. So because they are now narrow, the pressure within them is very high. And what are the consequences of this? Even though this doesn't give sign, I know a lot of people would say, okay, when their BP is high, they know because they start having headaches, or for some of them, they start having ringing sensation in their ear. But the thing is that even when you have headaches, it simply means that your blood pressure is now very high. So your blood pressure may be 140/90, and you wouldn't have any signs. It wouldn't cause you pain. It doesn't cause any pain, which is why I describe hypertension like professional witches and wizards. The real witch and wizard is your friend. They act as if they are for you. They play with you. They are like the rat that blows breeze on your leg while it is eating your feet. You don't feel any sign, and it is this lack of signs that make people feel very relaxed till boom, they come down with a stroke, because hypertension is the commonest cause of strokes. And if you've seen somebody with stroke before, even when they have the so-called partial stroke, you can imagine how miserable life can be for them. It can cause one to have a heart attack. It can cause one to have kidney failure. And if you've looked on TV and seen when people are soliciting for funds for kidney transplants, you realize that it's like you worked all your life, and by the time you're 50, you're 60, you are looking to spend all your gratuity, all your income to do a kidney transplant or to manage the stroke, which is why we give medication for stroke, for hypertension, even when it has never done any damage. So why am I saying this? I want you to start seeing this medication, start seeing it as your friend. Start seeing it as, I am doing this to ensure I don't have a stroke. I am swallowing this tablet to ensure I don't come down with kidney failure. I am doing this to ensure that I don't use a wheelchair for the rest of my life and have to wear diapers for the rest of, because many people, when they have stroke, many times they may need to now be on diapers. It is very expensive. So I'm spending 6,000 naira, I'm spending 3,000 every month, so that I don't spend 60,000 naira on hospital admission, so that I don't go and give my money to the doctors or to the hospitals. That's how I want you to see this. I want you to see this as your friend. It is not a lack of faith to take drugs. Hypertension, I want to emphasize this, hypertension is not curable. If you take your tablets today, you will see your BP comes down. Leave it for the next 2-3 days and it bounces back up. Sometimes we get so busy with life. I ask myself, what's the essence of working if at the end of the day I ain't going to enjoy my money? So they say that when the purpose of a thing is not known, abuse is inevitable. Simon Sinek said that the most important question we should be asking is why. So when your doctor gives you these medications to take, I want you to understand that even though you may not have the time to have this conversation, which is why we are doing these videos, that the why is that this tablet is going to protect you from the stroke. The why is that this wisdom that was used to create this tablet, all wisdom comes from God, is going to protect you from kidney failure. So that is why you are taking the tablet. That is why you shouldn't do it so that your doctor doesn't shout at you. The truth is that your doctor may be your friend, your doctor may know your name, but you are just work. It's just like the bus conductor. When I'm coming close to the bus conductor, he doesn't see me as his personal person. He sees me as passenger. He sees me as money. So your doctor sees you as work. Even if you are not paying directly, maybe you go to a government hospital, your doctor sees you as work. So you shouldn't take your drugs because you want your doctor to be happy with you. You should take your drugs as a sign of self-care, as a sign of self-responsibility, that I'm adult enough, I'm responsible enough to take care of myself. That is how I want you to see these tablets. So having said that, I want to believe that it has sunk in. Having said that, there are two conditions wherein you may need to stop taking your medication. Again, before I forget, there's something else I need to say before I mention those two conditions. No two people are on the same dose of antihypertensives. So husband may be on 1 tablet, wife may be on 3. I see couples make, or even friends, brothers, make the mistake of, this is a drug they gave me, I bought it when I went to India for medical checkup, you can use it. No. Hypertension medications are not like malaria drugs that, okay, all adults, we know that, okay, they take 1 tablet or they take 4 tablets. No. It is based on your blood pressure, it is based on how you respond to treatment that we adjust your drugs, which is the essence of you going for follow-up. So you may find out that initially you were on 1 tablet, maybe later you are now on 3, or vice versa. Do we get that? So don't share your medications. No, don't share your medications with anyone. So what are the two conditions wherein you may need to stop taking your antihypertensives? So if you keep on checking your blood pressure and you are getting blood pressure less than 100/60, don't just stop it. Because take, for instance, there are some tablets, like this tablet, for instance, it has 2 drugs inside. There are some of them that have 3 drugs inside. So sometimes if somebody's blood pressure is now going, rather than stopping the drug, we may decide to just go down to 1 tablet. So even when you start having 160, that is not an indication for you to just stop on your own. It is still better for you to seek the advice of your healthcare professional, a qualified one, not the one that is on your street, if you know what I mean, to advise you on what to do. Sometimes you may decide to take off one and leave the other. It is better that they decide which one to take off, because they know your full medical history and they know that, okay, this one is better for him than this other one. Okay, now the second condition, so you need to check your blood pressure to know when to stop. Don't just stop on your own. The second condition wherein we stop people's antihypertensives is if maybe you first noticed it during pregnancy. So women come down with hypertension when they are pregnant. They may even have the preeclampsia, where they start seeing protein in their urine, their body is swelling so much. For many of these women, after they give birth, their blood pressure goes back to normal. So again, it is best for you to keep on going for your follow-up, so your healthcare provider assesses you and decides that you can now stop your medication. Because some people, after giving birth, the BP still stays up. So that you have put to bed and you have stopped taking your routine drugs doesn't mean you should also stop your BP medication without proper advice from your healthcare provider. I hope this video has helped to clarify some few things in your mind, and I hope you're happy. You don't feel like, I didn't tell you what you want to hear. No, you shouldn't always be friends with people that tell you what you want to hear. Sometimes you need to hear cutthroat. So taking these medications is actually you doing yourself some self-care if you're living hypertension. If you have a parent, a relative, a brother, a sister living hypertension, from time to time when you check up on them, also ask them, have you taken your medication? Encourage them, console them, give them that mind to know that they are doing this for themselves and not for their doctors. And it doesn't mean that their own was passed. No, it just means that such is life. Thank you very much for watching. If you found this video useful, kindly share it on your social media platforms. Share it through WhatsApp to your friends or your WhatsApp groups where you know that it's going to help people. Thank you very much for listening. Once again, this is Chilling with Your Doctor.